I worked the emergency desk at a Stockholm hospital when an American tourist stumbled in holding his ankle. He'd twisted it badly on cobblestones. I asked for his European health insurance card. He stared at me like I'd spoken Martian. "I have Blue Cross Blue Shield," he said, sliding his American insurance card across the desk. "Just bill them directly," I explained. "We don't accept American insurance." He'd need to pay up front, then seek reimbursement back home. His face went pale. "Wait, you want me to pay? Out of pocket?" "That's illegal. Healthcare is a right," I nodded. "Yes, it is. That's why we have universal healthcare funded by taxes. You're not in our tax system, so you pay as a foreign visitor." He wasn't listening. He was Googling something on his phone. Then he looked up triumphantly. "According to the Geneva Convention, you have to treat me for free." "I'm an American citizen." I blinked. "The Geneva Convention covers prisoners of war in conflict zones." "Exactly," he said, "and I'm in distress." "That counts." He demanded to speak with our billing department supervisor to straighten out this administrative error. When my supervisor arrived and repeated the same policy, he threatened to call the American embassy to report our hospital for insurance fraud. The X-ray showed a minor sprain. Treatment cost 1,200 kronor, about $110. He paid with his credit card, furious, and left muttering about Swedish socialism being a scam that charges Americans extra. A Norwegian tourist behind him in line had been waiting with a cut hand. She paid her 300 kronor fee without comment. The American had spent 40 minutes arguing over a bill cheaper than his monthly insurance premium back home. My cousin manages a pharmacy in Amsterdam. An American woman rushed in, demanding her prescription for blood pressure medication. She handed him a paper from her doctor in Texas. "I need this filled today," she said. "I'm out of pills." He explained Dutch pharmacies can't fill American prescriptions. She'd need to see a Dutch doctor first for a local prescription. "That's ridiculous. It's the same medication. Just give me what's on the paper." He showed her the regulations. She pulled out her insurance card. "I have Aetna. They cover international pharmacies. Just run it through," he explained again. "No American insurance is accepted." She'd pay out of pocket, see a doctor, then file claims at home. She went nuclear. "This is a scam. You're trying to make me pay twice for the same pills? I already paid my deductible this year." She demanded he call Aetna to verify coverage. When he refused, she called them herself, on speaker, in the middle of the pharmacy. The Aetna representative patiently explained their international policy. She'd have to pay up front. "So you're telling me my $600 monthly premium doesn't work in Europe? What am I even paying for?" The representative suggested she should have purchased travel insurance. She lost it. "I have insurance. I'm looking at the card right now." She left to find the nearest hospital. My cousin learned later she'd spent 3 hours in a walk-in clinic, saw a doctor within 20 minutes, got her prescription, and paid €80 total. She wrote an angry Facebook post about European healthcare being disorganized because they don't accept American insurance cards. Back in Stockholm, we had an American man arrive by ambulance after a cycling accident. Minor concussion, some road rash. After treatment, we presented the bill. 3,000 kronor. Roughly $280. He laughed. Actually laughed. Nice try. Ambulance rides cost $3,000 minimum in America. You're missing a zero. I assured him the amount was correct. His smile faded. "Wait, you're serious? How is that possible?" I explained our healthcare system. He sat there doing mental math, looking increasingly disturbed. "So, if I lived here, this would be free?" "You'd pay through taxes, but yes, no bill at the point of service." He stared at his invoice. Then he asked how much it cost to become a Swedish citizen. He wasn't joking. A German colleague told me about an American tourist in Berlin who went to the ER with severe food poisoning. They treated him, kept him for observation, gave him IV fluids and medication. Total bill, €450. He asked where the itemized charges were. They gave him the invoice, one line item, total cost. No, the real bill. The one that breaks down every single thing. Each IV bag, each medication dose, The room fee per hour? The doctor consultation fee? The administrator explained that's not how they bill. It's a flat rate based on the treatment category. He insisted they were hiding charges. I know how hospitals work. There's always hidden fees. Show me the real numbers. They showed him their standardized pricing sheet. He demanded to see an itemized breakdown anyway, when they explained no such document exists. He announced he was disputing the charge with his credit card company for fraudulent billing practices. He claimed any hospital refusing to provide itemized charges was obviously running a scam. He filed complaints with the German Health Ministry, the Berlin Tourism Board, and the U.S. Embassy. His credit card company sided with the hospital. He paid the €450 and wrote a blog post warning. Americans that German hospitals refuse transparency and are probably overcharging everyone. Have a friend who works at a Tokyo clinic catering to international patients. An American man came in needing insulin. He'd run out during his trip and needed a refill. She explained he'd need a consultation with their doctor first. Then they could issue a Japanese prescription. Total cost for consultation and insulin, about 8,000 yen, roughly $55. $55 for insulin? What's the catch? She assured him that was the actual price. He didn't believe her. I pay $340 per vial at home. You're telling me it's $55 here? For real insulin? Not some generic knockoff? She showed him the medication's same brand, same formulation. He examined the box suspiciously. Is this FDA approved? She explained the FDA doesn't regulate Japanese pharmaceuticals. Japan has its own agency. His eyes widened. So this isn't real insulin. It's some unregulated foreign version. She assured him it was identical. He pulled out his phone and started Googling whether Japanese insulin was safe for Americans. He found a forum post from 2011 where someone said they got sick from medicine in Asia. He showed her the screen. See, I knew it. This stuff isn't properly tested. After 20 minutes of discussion, he reluctantly agreed to the prescription. He used the insulin throughout his trip with no issues. On his last day, he came back to the clinic and asked if he could take extra boxes home. If I buy 10 vials here, that's $550. In America, that's 1 month's supply. Here, it's almost a year. She explained customs regulations about bringing medication across borders. He left disappointed, muttering about American pharmaceutical prices being somehow legal. In Prague, my sister works as a hotel concierge. An American guest came down in a panic. His wife needed an EpiPen severe allergies, and she'd forgotten hers. My sister directed him to the nearest pharmacy, 5 minutes away. He sprinted out. 20 minutes later, he returned, looking shell-shocked. They sold it to me, he said slowly. No prescription needed. Just sold it to me. For 900 koruna. My sister nodded. Yes, about $40. Is your wife all right? She's fine, but this thing costs $600 in America? With insurance. How is it $40 here? She shrugged. That's the price. He stood in the lobby holding the EpiPen, staring at it like it was a magic artifact. I could buy 15 of these for the price of one back home. That's insane. That's not capitalism. I don't even know what that is. He went back to the pharmacy and bought 5 more. Maximum they'd sell him. He spent the rest of his trip telling everyone at the hotel about the EpiPen prices. Other American guests started asking him where the pharmacy was. A friend in Mexico City works at a dental clinic popular with American medical tourists. An American woman came in needing a root canal. They quoted her $150. She asked them to repeat it. $150? For everything. The procedure, the crown, all of it? They confirmed. She sat silently for a full minute. My dentist in Arizona quoted me $2,800. I thought you'd say like 1,000. She got the root canal. Afterward, she asked for a breakdown to submit to her American dental insurance. They gave her the invoice. She stared at it. Will my insurance cover this? The receptionist explained most American dental plans reimburse based on usual and customary rates. She might get $150 back, so I'd pay $150 here. or $2,800 at home, and insurance covers the same amount either way. Exactly, she booked 3 more dental appointments for other work she'd been putting off. Before leaving, she asked if they did hip replacements. The most memorable case was a couple from Florida at our Stockholm hospital. The wife had appendicitis. Emergency surgery, 3 days in hospital, full recovery. Total bill, 18,000 kronor, about $1,700. The husband studied the invoice in disbelief. This includes everything. Surgery, anesthesia, the room, meals, medication, everything. Everything. He pulled out his phone and showed me a hospital bill from back home. His daughter's appendectomy the previous year, $48,000. After insurance, they'd paid $12,000 out of pocket. We paid 7 times more for the same surgery. In America, with insurance, his wife was in tears, partly relief from the surgery, partly shock at the bill. They'd been terrified about costs. Had called their insurance company before her surgery, been told they might owe tens of thousands. The husband asked if the bill was real or if more charges would come later. I explained Swedish hospitals don't surprise bill. This was the complete cost. So you're telling me, if we lived here, this surgery would be essentially free through taxes, but because we're tourists, we have to pay $1,700? Correct. He sat down heavily. We pay $1,400 a month for health insurance. Every month, and we still paid $12,000 for my daughter's appendix? You're telling me your entire country provides this for everyone? For less than what we paid just for one surgery? I didn't know what to say. He wasn't angry. He looked genuinely heartbroken. They paid the bill without argument. As they left, the wife turned back. Thank you for taking care of me. I'm sorry about our system. I didn't understand how bad it was until now. Working in healthcare here, you see this constantly. Americans arrive expecting astronomical bills, then experience sticker shock in reverse when reality hits. Some argue, some deny, some file complaints, but most just stand there quietly, doing the math, realizing what they're missing. The stories keep coming: tourists, expats, business travelers, all confronting the same jarring truth. Healthcare doesn't have to cost what they've been told it costs. The system they've defended, the premiums they've paid, the bills they've accepted, it doesn't have to be that way, and that realization, for many, is harder to process than any medical diagnosis.